flaps are classified based on their blood supply, composition, and design. Here's a detailed classification. 1. Based on blood supply. This is the most common classification, reflecting the vascular anatomy. Mathis and Nahai classification. Type 1, single dominant vascular pedicle, axillaris flap. Type 2, one dominant and one or more minor pedicles. Example, sartorius flap. Type 3, two dominant pedicles. Example, rectus abdominis flap. Type 4, segmental vascular pedicles. Example, sartorius flap. Type V, one dominant and multiple segmental pedicles. Example, latissimus dorsi flap. Chart 2, based on composition, pure musculocutaneous flaps include both muscle and skin with their vascular supply. Example, rectus abdominis flap. Composite flaps include additional tissue types such as bone or fascia. Example, free fibula osteocutaneous flap. PA 3. Based on design and transpedicled flaps, retain their original blood supply and are tunneled to the defect. Example, pectoralis major flap. Free flaps. Detached completely and revascularized at the recipient site using microvascular anastomosis. Example, latissimus dorsi free flap. 4. Based on function. Functional flaps. Used to restore function, such as muscle contraction or movement. Example, gracilis muscle flap for dynamic facial reanimation. Non-functional flaps, primarily used for coverage or bulk. Example, latissimus dorsi for breast reconstruction. 5. Based on location, upper limb flaps, e.g. deltopectoral flap. Lower limb flaps, e.g. gracilis or gastrocnemius flap. Trunk flaps, e.g. latissimus dorsi flap. Each category reflects the versatility of musculocutaneous flaps in reconstructive surgery, with the choice depending on the defect's location, size, and specific functional requirements.